Auzubillahiminash-shaytanir-rajim. Bismillahir-Rahmanir-Rahim. In the name of Allah, the most beneficial and the most merciful. Today, I will tell you that how we can diagnose uterus on clinically and ultrasound. Uterus is very important in pelvic region. This is a peak of urinary bladder. Above urinary bladder, there are the abdominal wall muscles, and behind urinary bladder, there are uterus and ovary. Ovary are connected to the uterus. This is another peak of normal uterus. Its length, width, and thickness. Uterus normal thickness is 3 cm. Length is 8 cm and the width is 5 cm. These all are normal measurements of uterus. If the measurements of uterus are not correct, it means there are some abnormality in the uterus. So whenever you perform the USG of uterus, first of all, measure the length, width and thickness. By taking the measurements of uterus, its normality and abnormality both can be assessed. So, uterine measurements are very important in pelvic scan. Now look at this peak. There is a urinary bladder. Behind urinary bladder, there is a uterus, uterine fundus. The topest part is uterine fundus. Inside fundus, there is myometrium, endometrium, and posteriorly cervix and vagina. This is another peak of urinary bladder. Behind urinary bladder, there is a normal uterus and vagina. This is a normal peak of uterus. Look at this peak carefully so you can diagnose on ultrasound clearly. Look at this peak. The blackish part is bladder, urinary bladder. Behind urinary bladder there is a uterus, and the whitish part, these 3 whitish lines is called endometrium, and behind endometrium there is a myometrium. This is an anatomy of uterine parts: uterus, fallopian tube, ovary, vagina, vulva and cervix. This is another peak of uterus, ovary, ovarian ligament, myometrium, cervix, endometrium. Whenever you will perform the USG of uterus, always remember uterine measurement first of all, its length, thickness and weight. Now look at this video carefully. There is a normal uterus, myometrium, endometrium. There is no any fibroid, no any abnormality. This is a normal uterus.